5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they're being over-tested. One of these checkups, the number 1 on our list, actually causes 5% of all cancer cases in the US, which is equal to the number of cases caused by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard, but the truth is buried in the science. And today we're uncovering it all. In this video, the 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your body. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Number 5, bone density scan. It sounds harmless. A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a bone density scan can often create more fear than benefit. This scan, which is officially called a DEXA scan, measures how strong your bones are. It's primarily used to detect osteoporosis. And yet many seniors are pushed into taking medications like bisphosphonates, which are supposed to strengthen bones but come with serious side effects. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. Instead, those women were far more likely to suffer from medication side effects, including digestive issues, inflammation in the esophagus, and brittle bones. Let me tell you about Rose, a 76-year-old retired piano teacher who was referred for a DEXA scan after her annual checkup. Her doctor immediately started her on alendronate, which is a bisphosphonate. 3 months in, she developed severe reflux and jaw pain. We took her off the meds, started her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 20%. Number 4, brain MRI for memory loss. When seniors feel more forgetful or confused, the natural impulse is fear. So, doctors often respond by ordering a brain MRI. But here's the uncomfortable truth. In 2021, a study reviewed over 3,000 MRI scans in patients aged 70 to 85. 86% showed some form of brain abnormality, but only 3% of those findings were linked to an actual treatable condition. That means 97% of people went through the emotional toll for nothing. Take George, a 74-year-old retired engineer who came in worried about forgetfulness. He misplaced his keys more often and forgot names sometimes. His doctor sent him for an MRI that showed white matter changes. He panicked, convinced he had dementia. He stopped driving, stopped going to church. A better first step is a cognitive screening test, which is a simple paper-based exam that evaluates memory, attention, and problem-solving. We helped him focus on lifestyle interventions like sleep, hydration, and brain games. Within 3 months, his memory had stabilized. Number 3, cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue or chest tightness. The cardiac stress test monitors your heart while walking on a treadmill, meant to spot blocked arteries. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%. That leads to follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real benefit. What they did have were higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. This happened to Raymond, a 75-year-old retired postman who stayed active by walking every day. The results were unclear, so he was sent for catheterization. A mild narrowing was found and a stent was placed. A better option is often a resting EKG, which looks at the heart's rhythm while you're still. or even a coronary calcium scan, which is a low-radiation imaging test that shows whether dangerous plaque is building up. Number 2. Colonoscopy. You probably didn't expect this one, but colonoscopy is not always a wise choice after age 70. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues. A 2019 study followed over 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-1 risk-to-benefit ratio. The test itself can cause bleeding, tearing, or even heart rhythm disturbances. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in stool. During the procedure, a small polyp was removed. That night, she experienced intense abdominal pain and fainted. They found a bowel perforation. For those in excellent health, a stool-based test like the FI test is often a safer option. It has no prep, no sedation. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. And now, we've reached the most overused, most dangerous, and most harmful checkup for seniors. Number 1. Annual full-body CT scans. These scans expose your body to a high dose of ionizing radiation. The irony is there is zero evidence that full-body scans save lives. Each scan delivers between 10 to 20 millisieverts of radiation, which is equal to around 500 chest X-rays. According to a 2023 study, the rise in CT scans may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. The scan can detect harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they are seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marcus, an active 80-year-old who used to teach martial arts to younger seniors. He felt great. The result? Benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery. The American College of Radiology is clear. There's no proven benefit and significant potential for harm. If there are symptoms like unexplained weight loss or coughing up blood, then targeted imaging makes sense. So there you have it. 5 checkups that may seem helpful but can actually hurt, especially once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Have you or someone you love ever faced complications from a medical test that turned out to be unnecessary? Share your experiences in the comments below. Thanks for watching.